Welcome to today's video about symptoms of menopause. Have you been feeling tired for no reason, waking up drenched in sweat, or suddenly snapping at your loved ones and wondering, what is happening to me? You're not alone. Right now, over 1.1 billion women worldwide are either going through menopause or will experience it in the next decade. That's right, 1 in every 7 people on Earth. And yet, so many symptoms go ignored, misunderstood, or brushed off as just stress or getting older. But what if your body is actually trying to warn you? What if those strange changes are backed by science and understanding them could help you feel like yourself again? Backed by the latest medical research, this video dives deep into the 14 proven symptoms of menopause, from the ones you expect to the ones no one talks about. And stick with me till the end, because I'm going to share one powerful insight that could completely shift the way you understand your health during this time. Ready to take control of your body and your peace of mind? Let's get into it. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's dive into the key symptoms of menopause, starting with number 1, hot flashes. Experiencing sudden waves of heat that seem to come out of nowhere? You're not alone. These episodes, known as hot flashes, are a hallmark of menopause, affecting up to 80% of women during this transition. They can strike at any time, leaving you flushed, sweaty, and sometimes even anxious. The root cause lies in the body's internal thermostat, the hypothalamus. As estrogen levels decline during menopause, the hypothalamus can become more sensitive to slight changes in body temperature. This hypersensitivity can cause the body to overreact to minor temperature increases, triggering rapid cooling responses like vasodilation and sweating. The result? An intense sensation of heat spreading through the upper body and face. Recent research has shed light on potential new treatments for hot flashes. A study published in Nutrients, 2024, examined the efficacy of fezolinetant, a neurokinin -3 receptor antagonist, in alleviating moderate to severe vasomotor symptoms associated with menopause. The findings suggest that targeting specific neural pathways may offer relief for those suffering from frequent hot flashes. While hot flashes are a natural part of menopause, they can be disruptive. Understanding their cause is the first step toward managing them effectively. If you're finding these episodes challenging, consider discussing both hormonal and non-hormonal treatment options with your healthcare provider to find the best approach for you. Next, number 2, night sweats. Waking up drenched in sweat even when the room is cool can feel alarming. For many women in their 40s and 50s, this isn't about the temperature outside, it's a sign of hormonal changes happening inside. During menopause, estrogen levels drop sharply. That shift messes with the body's internal thermostat, making it think you're overheating even when you're not. As a result, your body kicks in to cool you down, blood vessels expand, and you start sweating heavily. This isn't just occasional. For some, it happens every night, disrupting sleep and affecting mood, memory, and daily energy. It's more than just a discomfort, it's a physiological reaction backed by science. A 2021 study in menopause found that menopausal women experience night sweats. The researchers also discovered a direct link between the intensity of night sweats and lower estradiol levels. These changes don't just pass quietly, they impact your sleep and well-being in real, measurable ways. If your nights are getting soaked with sweat, it might be your body's way of signaling this natural life transition. Next, number 3, sleep disturbances. Ever found yourself wide awake at 3 a.m., staring at the ceiling, wondering why sleep just won't come? For many women going through menopause, that's a nightly reality. Hormonal shifts, especially the drop in estrogen and progesterone, can seriously mess with your body's natural sleep cycle. These hormones aren't just about reproduction, they actually play a big role in calming the brain and helping you drift off. Lower estrogen levels can cause body temperature to rise at night, leading to sudden heat surges, those infamous night sweats. They jolt you out of deep sleep, leaving you groggy the next day. But it's not just about sweating. Progesterone, often called the natural sleep pill, also dips during menopause. Without enough of it, falling asleep and staying asleep becomes a real struggle. One study published in the Sleep Medicine Clinics, 2019, found that 40 to 60% of menopausal women reported moderate to severe sleep problems, including frequent awakenings and trouble falling back asleep. That's more than half. You're not imagining it. If your nights are getting harder, it might not be stress or your schedule. It could be your hormones working behind the scenes. Understanding this can be the first step to getting your nights back. Next, number 4. Mood swings. Feeling unusually irritable? Tearful for no clear reason? That emotional roller coaster might not be just stress. It could be tied to hormonal changes during menopause. As estrogen levels drop, it directly affects brain chemicals like serotonin and dopamine. These are the same neurotransmitters that help stabilize mood. When they fluctuate, your emotions can feel unpredictable, happy one moment, anxious or low the next. A 2021 study published in the journal Psychoneuroendocrinology showed that midlife women reported increased irritability, sadness, or anxiety during the menopausal transition. That's a huge number. The research also highlighted that estrogen receptors are found in areas of the brain linked to mood regulation, such as the amygdala and hippocampus. When estrogen drops, those areas become more sensitive and reactive. It's not all in your head, it's biology. And if you've been snapping at loved ones or feeling off emotionally, you're not alone. These shifts are real, and they're backed by science. Recognizing the cause is the first step toward managing it. Don't brush it off. This is your body's way of signaling change. Next, number 5, memory problems. Hormonal changes during menopause can significantly impact brain function, particularly memory. Estrogen, a hormone that supports cognitive processes, declines during menopause, leading to noticeable memory lapses. For instance, you might find yourself entering a room and forgetting your purpose, or struggling to recall recent information. A study published in Frontiers in Aging Neuroscience in 2023 observed that perimenopausal women exhibited impairments in verbal memory during early and late perimenopause. Additionally, there was a lack of improvement in processing speed during the late perimenopausal phase compared to the pre- and postmenopausal phases. Stress and sleep disturbances, common during menopause, can further exacerbate these memory challenges. Even if you've always been organized, you might now feel that your cognitive abilities aren't as sharp, which can be frustrating. It's essential to understand that these changes are biological and not a reflection of personal shortcomings. Recognizing that many women experience similar challenges can provide reassurance. Researchers are increasingly focusing on how menopause affects cognitive functions, aiming to offer better support during this transition. Next, number 6. Decreased libido. As women approach menopause, it's common to notice a shift in sexual desire. This change is primarily due to declining estrogen levels, which can lead to vaginal dryness and discomfort during intercourse, making sexual activity less appealing. Additionally, testosterone, a hormone influencing libido in both men and women, decreases with age, further contributing to reduced sexual desire. Beyond hormonal changes, other menopausal symptoms like sleep disturbances, mood swings, and fatigue can indirectly affect libido. For instance, disrupted sleep can lead to decreased energy levels, making intimacy less of a priority. Emotional changes, including increased anxiety or depression during menopause, can also diminish interest in sexual activity. Recent research has explored treatments to address these concerns. A study presented at the Menopause Society's 2024 annual meeting highlighted that cognitive behavioral therapy, or CBT, may effectively improve sexual function in postmenopausal women. Participants who underwent a 4-session individual CBT protocol reported enhancements in sexual desire, arousal, and satisfaction. Understanding these changes is vital. If you're experiencing a decrease in sexual desire during menopause, know that it's a common occurrence. Open communication with your healthcare provider can lead to effective strategies and treatments to help navigate this phase, ensuring a fulfilling quality of life. Next, number 7, fatigue. As women approach menopause, many notice a significant dip in energy levels. This isn't just a coincidence, it's closely tied to the hormonal shifts happening in the body. During perimenopause, the transitional phase leading up to menopause, the ovaries gradually produce less estrogen and progesterone. These hormones play a vital role in regulating cellular energy. As their levels fluctuate and decline, it's common to experience feelings of exhaustion and decreased stamina. Recent research sheds light on another contributing factor: heavy menstrual bleeding during perimenopause. A study published in Menopause in 2025 found that women experiencing heavier or prolonged periods were significantly more likely to report fatigue. Specifically, those with heavy menstrual bleeding had a 44 to 62% increased chance of feeling tired or worn out. This connection is likely due to the loss of iron during excessive bleeding, leading to iron deficiency, a well-known cause of fatigue. Understanding these factors is crucial. If you're navigating this phase and feeling persistently tired, it's essential to consult with a healthcare provider. They can offer strategies and treatments tailored to your needs, helping you regain energy and maintain your well-being during this transition. Next, number 8, thinning hair. During menopause, many women notice their hair becoming thinner. This change is largely due to declining estrogen levels, which play a crucial role in maintaining hair growth. As estrogen decreases, hair follicles may shrink, leading to finer, shorter strands and increased shedding. A recent study published in Menopause, 2022, found that 52% of postmenopausal women experienced hair thinning or loss. This highlights how common this issue is during this stage of life. Beyond hormonal changes, factors like genetics, stress, and diet can also influence hair health during menopause. For instance, a family history of hair loss may increase your likelihood of experiencing similar issues. Managing stress and maintaining a balanced diet rich in essential nutrients can support overall hair health. If you're noticing significant hair thinning during menopause, it's advisable to consult a healthcare provider. They can help identify any underlying causes and discuss potential treatments, such as topical minoxidil or hormone therapy, to address the issue effectively. Next, number 9, dry skin. Experiencing persistently dry skin can be more than just an annoyance. It might be signaling hormonal changes associated with menopause. As women approach menopause, estrogen levels decline significantly. This hormone plays a crucial role in maintaining skin hydration by promoting the production of natural moisturizers like ceramides and hyaluronic acid. With reduced estrogen, the skin's ability to retain moisture diminishes, leading to dryness and itchiness. A recent study published in Cosmetics, 2024, investigated the impact of menopause on skin health. The researchers found that 21.4% of postmenopausal women reported increased skin dryness, highlighting the prevalence of this issue during menopause. Understanding this connection is vital. If you're noticing increased skin dryness during your menopausal transition, it's not just an external issue, but a reflection of internal hormonal shifts. Consulting with a healthcare provider can help you explore options like hormone replacement therapy or specialized skincare routines to alleviate discomfort and maintain skin health during this phase. Next, number 10, heart palpitations. During menopause, many women notice their heart beating faster or irregularly. This sensation, known as heart palpitations, can be unsettling. The primary reason is the fluctuation and eventual decline in estrogen levels during menopause. Estrogen plays a role in regulating the cardiovascular system, and its reduction can lead to increased heart rate and sensations of a racing heart. Recent studies have shed light on the prevalence of this symptom. Research published in the Menopause in 2024 found that up to 42% of postmenopausal women experienced palpitations. These palpitations were often linked to stress, sleep disturbances, and decreased quality of life. While palpitations during menopause are common and often benign, it's essential to monitor them. If they become frequent, are accompanied by dizziness, shortness of breath, or chest pain, it's advisable to consult a healthcare professional to rule out other potential heart conditions. Next, number 11, irregular periods. As you approach your 40s or 50s, your monthly cycle may start acting upcoming early, skipping months, or dragging on longer than usual. This isn't just random. It's often a sign that your body is moving toward menopause. During this time, your ovaries slow down and hormone levels shift. While estrogen and progesterone get most of the attention, other hormones like luteinizing hormone and follicle-stimulating hormone, or FSH, also play a big part. These hormones control the release of eggs from the ovaries. When their levels become erratic, your cycle does too. Researchers have found that irregular periods are one of the earliest and most noticeable signs of perimenopause, the transition phase before menopause. A 2008 study published in the Fertility and Sterility found that changes in menstrual cycle, length especially those varying by more than 7 days can, begin up to 7 years before the final period and are closely tied to fluctuations in FSH levels. This hormonal instability causes your periods to become less predictable over time. If your period's rhythm feels off lately, your body might just be preparing for its next chapter. Next, number 12. Bone loss or osteoporosis risk. During menopause, your body goes through major hormonal shifts, and these changes can quietly impact your bones. One key player is follicle-stimulating hormone. While it's often overlooked, high FSH levels around menopause have been shown to accelerate bone loss, even when estrogen levels are still relatively stable. That means your bones could start thinning before your periods fully stop. You might not feel this happening, but over time, your bones can become porous and fragile, a condition known as osteoporosis. It raises your risk for fractures, especially in the spine, hips, and wrists. According to a 2022 study published in the Journal of Bone and Mineral Research, FSH plays a direct role in stimulating bone resorption, the process where bone is broken down and its minerals released into the blood. The researchers found that blocking FSH in mice reduced bone loss, suggesting a new direction for managing postmenopausal osteoporosis. If you're going through menopause, this is something worth tracking. A simple bone density scan can catch changes early. Staying active, getting enough calcium and vitamin D, and checking hormone levels with your doctor can make a big difference in protecting your bones long term. Next, number 13, joint and muscle pain. You might be surprised to learn that those nagging aches in your muscles or stiffness in your joints could be tied to hormone shifts during menopause. As hormone levels drop, especially estrogen, other key players like cortisol and serotonin also get thrown off balance. That mix-up can increase inflammation and lower your pain threshold, making your body more sensitive to discomfort than usual. Think about it. Your joints feel sore after simple tasks, or your muscles stay tense even when you're not pushing yourself. That's not just age, it's your body reacting to hormonal changes. A 2020 study published in Neuroplasticity confirmed this. Researchers found that over 60% of midlife women reported moderate to severe musculoskeletal pain directly linked to hormonal fluctuations. Even your sleep quality and energy levels can play a role. Poor sleep, another menopause-related issue, reduces your body's ability to repair tissue overnight, leading to sore, tight muscles when you wake up. The result? A body that feels older than it is. Next, number 14, urinary issues. Menopause brings about various changes in a woman's body, including shifts in urinary function. One common issue is urinary incontinence, where there's an involuntary leakage of urine during activities like coughing or exercising. This can be both inconvenient and distressing, affecting daily life and self-confidence. A recent systematic review published in Curious in 2024 highlighted that the prevalence of urinary incontinence among postmenopausal women ranged from 13.6% to 84.4%, with a total prevalence of 63.1% across studies. This wide range underscores the variability and complexity of urinary symptoms experienced during menopause. Additionally, the genitourinary syndrome of menopause encompasses various urinary symptoms, such as burning during urination and increased frequency. These symptoms are often linked to changes in the vaginal and urinary tract tissues due to decreased estrogen levels. It's essential to recognize these symptoms as part of the menopausal transition. Consulting with healthcare providers can lead to effective management strategies, improving quality of life during this phase. That's it for today's video on the 14 proven symptoms of menopause backed by real research and real stories from women just like you. If any of this resonated with you or helped you connect the dots on what your body's going through, we'd love to hear from you. Just type helpful in the comment box if this video brought you value. It not only lets us know we're making a difference, it also motivates us to create more trusted, science-based content to support your health journey. And hey, don't forget to like, subscribe, and hit that notification bell so you never miss our next deep dive into women's health. You deserve answers. You deserve support. Thanks for watching, take care of yourself, and we'll see you in the next one.